Thank you for joining us today to our event, Who Cares? Including Men in Conversations about Care Work and Domestic Violence. We will be together until 12 today. We're currently at the introduction of our organization and the event. After that, we will go into the presentations by Heinrich, Ellie, and Dimi, who will share insights from the Engage, Men in Care, and Fathers Rock projects. I really look forward to that, and it's going to be really interesting. Then, because we want you to feel good, and this is a long online event, we're going to have a 10-minute break for you to do your thing, jump up and down, get a cup of coffee, whatever feels good for you. And then we're going to meet back here for breakout rooms. We've prepared some interesting questions for you to discuss, and we're going to have an hour with breakout rooms and a discussion. And then at the end, we're going to have a little bit of a closing, and we're going to ask you to fill out an evaluation form, which you don't have to do while you're in the event, but we're going to share a link with you for our evaluation. If you appreciate the work we do, we appreciate your feedback because our funders want to have it. So please share your feedback with us, your evaluation of the event. So who are we? We're the European Network for the Work with Perpetrators of Domestic Violence. As the name says, we are a European network that has members across many, many European countries. We're really, really proud of our members, which include perpetrator programs, researchers, research institutes, victim support services, also some government services. We have Laura from Romania, who represents our Seoul prison, who's also a member. So we're a diverse membership that all follow the mission to prevent violence in close relationships as a gender-based phenomenon. We want to foster gender equality. We want to improve the safety of women and children, as well as others at risk of violence in close relationships, through the promotion of effective work with those who perpetrate this violence. And one way that we do this is through our incredibly fabulous projects. We have many a project going on, and something that is really valuable to us is that we want to create synergies. I hate that word, but we want to use the results that we get from projects to develop better, well, not better, brilliant, just as good as the other projects, but we try to relate the results from the different projects to each other and use them to create projects that build on top of each other, so we can get really into depth and learn from the results of our projects. If you want to learn a bit more about them, we have our wonderful website, and you can look at, you can see it here where you can find our project. So you can find in-depth information on all of our projects here. We also regularly share project updates in our newsletters, and you can, follow us on social media, a little bit of promotion to see everything that's going on with us. But this is where you can find all of the information on our projects. Bless you, Oda. So the event today, when we sat down to prepare this event, we talked about our beliefs around the issue, and we believe that social change needs men's involvement. However, we see that men aren't included enough in discussions on care work and intimate partner violence. And we want to work towards shifting the conversations about relationships towards men also being accountable for these issues. So, when people look towards who's doing the care work, or also when we talk about domestic abuse, a lot of times we put a lot of pressure and responsibility and accountability on women in heterosexual relationships. And we want to work towards shifting that conversation to also have people think about the men in the equation. So we're thinking, okay, what can we do to facilitate that shift? And of course, working with men directly is a super important avenue of that. But also, and this is what we're going to focus on today, is how we can multiply our work by creating change makers that influence men's daily lives and that help plant a seed of male accountability in society. And yeah, so that's what we're going to talk about today. So what do we propose? We say, hey, go out into the world and work with professionals outside of our little anti-violence bubble, and open the eyes of these professionals to the role that they can play in social change. And one of the central questions is, of course, how can we help relevant professionals bring this accountability of men into focus when we talk about care work and domestic abuse, but also doing that without disempowering women. That's actually one of the discussion questions that we want you to take into the breakout rooms after the break and after the presentations. And I think it's going to make for a really interesting discussion at the end of this event. Where are we? Where am I on time? Oh, I'm perfectly in time. That's nice. So next up, we're going to jump into the presentations and into the lessons learned, and also insights into ongoing work by Heinrich, Ellie, and Dimi. And before we do that, I would like to briefly introduce you to our speakers. So first, we're going to hear from Heinrich, who is a psychologist and psychotherapist, as well as director of research and international projects at Conexos Association Barcelona. He's been active in the field of men's violence against women and children for over 20 years, where he's worked directly with men, had coordinating positions, has delivered trainings and presentations, as he does today, nationally and internationally. And he's also a researcher. So jack of all trades, master of all trades. Heinrich is a founding member of our organization, WWP EN, and has coordinated the Engage project, which he's going to talk about today, as well as participated in many other international research projects. I'm going to take a sip of water before going on to the next introduction. After Heinrich, we're going to hear from Ellie, who's a sociologist and managing director at the Institute for Masculinity Studies and Gender Research in Graz, Austria. She has coordinated numerous international studies focusing on men and gender equality, carrying masculinities, and gender-based violence prevention. She's also the scientific coordinator of the EU study, The Role of Men in Gender Equality, and the Men in Care study in Austria, that we're going to hear more about today. And last, but absolutely not leastly, we will hear from my fabulous colleague, Dimitra Mensidis, who is the project and financial manager at WWP EN. And her background is in sustainable and equitable development. And she specializes in international cooperation as well as European project development and management. In the past 15 years, she has been designing and working within different types of actions targeting social justice and innovation, education, and inclusion. And she is absolutely at least 70% of the brains behind every one of our fabulous projects. So a big round of applause to all of our speakers from my side. And I think I have one more. No, that's it. Yes. So I'm going to stop sharing my screen really quickly. I hope I didn't lose you. I'm still on time. I'm super happy. Heinrich, it is my immense pleasure to hand the word over to you for the insights to the Engage project.
Thank you so much, Anna, for this introduction and presentation. It's a great pleasure to be part of this event today with these fantastic women on the panel. And I will start to share my screen to tell you a little bit about the Engage project that I hope you can see this, that we ran in 2018 and 2019, that we coordinated. And
I can see your presentation.
The Engage project. Great. The idea behind the Engage project was the fact that, on the one hand, different studies from Marianne Hester, among others, had shown that many men who entered a perpetrator program had attended health or other services, social services, during the months before entering the perpetrator program. So there was an opportunity to talk to these men about their use of domestic violence and abuse. But on the other hand, that most guidelines on addressing gender-based violence in these services, health services, social services, only or majoritarily look at the victim survivors, look at how to address domestic violence and abuse with women, which leads to the fact that many professionals don't know how to address gender-based violence in their male service users, or are even afraid to do so. So there was a clear need for guidance and training on addressing perpetrators in these frontline services that we had also detected in many trainings among the partners of the project. So the aims of the project, as always, and everything that we do with perpetrators, was to increase the safety of women and children, in this case by fomenting a coordinated multi-agency response to perpetrators, and specifically also to improve the quantity and quality of referrals from these frontline services to the specialized perpetrator programs, mainly by building the capacity of frontline professionals to address perpetrators and refer them to the specialized services, but also to improve then the coordination between these frontline services and the perpetrator programs. And as Anna mentioned in the beginning, to shift the professionals' perspectives from the women's accountability or responsibility for the change to the men's or the perpetrator's accountability for the violence. So to create this shift in perspective and have people look further on the responsibility and accountability of the men who use violence. We ran the project, as I said, from 2018 to 2019, and had partners from France, Italy, and WWP as a partner for dissemination mainly, and we had a fantastic and very helpful advisory board with Marianne Hester from the University of Bristol and Neil Blacklock from Respect. What we did mainly in the three phases of the project was a needs analysis, where we talked to frontline professionals, of course, from different services, also talked to men about their experience of being addressed or not and being referred to perpetrator programs, and we talked to experts in the work with perpetrators, apart from looking at the literature and our own experience in this work. On the basis of this needs analysis, we then developed a roadmap, so a guideline for addressing addressing gender-based violence in male service users in frontline services, and a corresponding training package with a PowerPoint and some guidelines. We then had the pilot implementation of both the roadmap and the training in Spain, Italy, and France, and evaluated this, and on the basis of this evaluation and feedback, then revised both the roadmap and the training package, which are available, as Anna already mentioned, on the WWP website. So some brief results from the needs analysis. Most men told us that they had never been asked about violence by any professional, even if they had been in psychological treatment, even if they had mentioned difficulties, conflict in their relationships. And they said that it was helpful if being addressed for violence to be discussed gradually and give words to it gradually, and above all, not to be judged as monsters, not to feel judged by the professionals, but to be given a perspective change and the possibility of receiving support and help, and especially have more information on specialized service on perpetrator programs. From professionals, most of them had received any specific training on addressing domestic violence and abuse in men. Less than half knew where they could refer a man to, knew about a perpetrator program that they could refer a man to, and only very few had ever done so, had ever referred a man to a program. But on the other side, practically all professionals had identified domestic violence or abuse in some of their male service users, or at least had suspected that a man they worked with was perpetrating violence. Far less had addressed violence with the man. The main obstacles that professionals mentioned were the lack of knowledge, men's denial and minimization, of course, the fear of putting victims at risk, but also the fear of losing rapport or the therapeutic relationship, sometimes the fear of violent reactions towards the professionals, but also some legal concerns around addressing the violence, and of course the normalization of violence, own prejudices and positions towards violence and towards men who uses, including the impact, of course, of violence on professionals' personal lives also. So on the basis of this, we created the Engage roadmap, which was trying to give response to these needs, and the Engage training program, in which we usually have two parts. One first training session where we give an introduction on the project and the roadmap, have basic concepts, definitions, legal framework defined and addressed, talk about the relationship with the men who use violence, and then address and practically look at the 4 steps that both the roadmap and the training suggest, which is identify domestic violence and abuse in men through different indicators and signs, then asking men about their use of domestic violence and abuse through different questions, motivating the perpetrators for a possible referral if there is a minimum acknowledgement of the use of violence, and then if there is a motivation, referring them to a perpetrator and establishing the coordination with the perpetrator program. And the last point, the professional, personal, and legal dilemmas are addressed that are involved in this process. This is the initial session, which is 5 to 6 hours, and then we have a second follow-up session, a booster session, where we look at the transfer into practice. And here you can see how with the Engage training package, we try to put into practice what has been identified in the meta-analysis by Turner and colleagues as elements of effective training interventions around domestic violence, which is an experiential or discussion component. So we have some experiential exercises using videos, but also and above all role playings for each step of the roadmap for professionals to practice. Really, we have this booster session to look at the transfer into practice, what has worked, what hasn't worked, and possible solutions to obstacles. We deliver local perpetrator program professionals, deliver the program, so there is information on the services, and a protocol can be starting to be established in the training. And the Engage roadmap serves as a sample protocol, really, a sample protocol for intervention that then needs to be adapted to the local context, of course, in each service, depending on the local condition, perpetrator programs available. We did an evaluation without going into details. We asked the trained professionals about their identifications of domestic violence abuse in men in the last 3 months before the training, and then in the 3 months after the training, and saw an increase in identification of perpetrators, but above all in the referrals, which more than doubled. And we could confirm these data by data from the perpetrator program. So we didn't only ask the professionals who were trained, but also asked the programs whether they did receive more referrals from the trained services. And there was an increase of more than 25% from the trained services after the training in comparison to before the training. So there was quite a positive effect of the training. And just to wrap up, I don't know how I'm doing with.
We're at 10 minutes now, so wrap up. And yeah.
This is the last one. So it's really important in the trainings. We found that there is a previous knowledge on gender-based violence, domestic violence in general, for professionals to be trained on addressing it in men. So it is highly important that they have this previous basic knowledge and how to address it with women. The usefulness of the role-playing exercises and the personal reflections has been proven in the trainings, and the feedback from professionals does confirm that. Also, the booster session to really look at the uptake and transfer into practice and the possible obstacles to it has been proven very important. Creating realistic expectations also. In many cases, we won't see a result. We might not be able really to refer the man to a program, but we believe that it's still important to address the issue, even if in that occasion the man does not accept the referral. So that's important to have realistic expectations for professionals. The availability of perpetrator programs in some places there's no coverage really, so it is difficult to convey that to professionals that they should address domestic violence in perpetrator if there's not a program to refer. So that is important, and the importance of institutional support from leadership in the services for this work, and that is sometimes difficult. So if the directors of the center or if the leadership does not buy into the importance of this, it might be difficult for professionals to do the job, to really look at men's use of violence in their services.
Heinrich, thank you so much.
Yes, thank you so much. I'm looking forward to the discussions further on.
Yeah. Thank you, Heinrich. I forgot to mention beforehand, if you have any questions, please put them in the chat. We'll gather them and get to them at the end after the breakout rooms. We're pressed for time, so it is now my pleasure to hand over the word to Ellie Skambor, joining us from Graz, Austria, who's going to tell us more about the Men in Care project. So Ellie, over to your capable hands.
Yeah, thank you very much. Thank you for the opportunity to talk about the Men in Care project. And yeah, hello to all of you. It's always very impressive to see so many people taking part in such an event worldwide. So great. I would like to see if I'm able to share the screen now, if everything is fine. I guess you see my presentation, huh?
Yes.
Okay. So I will talk about caring masculinities at work. I will very briefly introduce, have 10 minutes now to introduce some of the study results from a European workplace study on caring masculinities. So it's the European project Men in Care. It was conducted from 2019 to 2022 in 8 partner countries. We also had a cooperation project in North Macedonia, I would like to say, and it was a really big study. It was conducted with 22 partners and co-funded by the European Union and also co-funded at national level. And as I said, it asked for good practices that enable men to balance care work and paid labor. So methodologically, we choose a qualitative approach. So we did 172 interviews in 6 partner countries, actually, in different companies. We did the interviews with HR, with human resource managers, gender equality, diversity representative, with men who took care tasks, and partly also with their partners. This is the concept we based our work on, the concept of caring masculinity, which had been developed based on empirical studies from the beginning of 2000 onwards, the work changes gender studies, the focus studies, the study on the role of men and gender equality. And care was, in our study on the role of men and gender equality, based on Nancy Fraser's concept of care as a human norm. And we widened the perspective. We're not just talking about fatherhood, we are talking about caring for elderly people, caring for colleagues, caring for environment, caring for gender equality, and also the rejection of violence and the rejection of male dominance. These are aspects of care. So this is just very briefly, this is the concept of caring masculinity on which we based our work on. So before I go into the results of the Men in Care study, I go back 20 years, because when we started to work at our institute in Graz, we actually established the institute through a European project. It was called Work Changes Gender, and it was actually exactly the same study like the Men in Care study, but 20 years before, from 2000 to 2004. So more than 20 years ago, the common response in companies asked about men in caring roles was, we don't have anything like that here. So at that time, gender was addressed in companies with preference to women. Men were not really talked about. Based on the findings from 2000 to 2004 in the Work Changes Gender study, we developed a 3 phases model of gender equality for companies, which I would like to briefly introduce because this was also the frame for the Man in Care study. So companies in the early phase, these are companies with initial considerations about gender equality. So women are usually addressed. Men with care tasks have a pioneer status. In middle phase companies, gender disparities and gender trouble becomes visible. In these companies, there is an advancement for women is in the focus, and it has usually some effects for men as well. So caring masculinity under this condition, they have some individual leeways. And in advanced stage companies, usually all genders are included in gender equality measures. We see proactive trends against overtime company culture. And we see a situation where employees and also men do not have the feeling that they have to beg for reconciliation measures. So in the 2005 Work Changes Gender study, men in the care context represented a new phenomenon, a rather new phenomenon. The process was in the early stage. So most companies were allocated to the early phase. While the situation has changed in the current Men in Care study, we also focusing on best practices. Most companies were in the middle phase. So it became clear that organizations are on their way, but it also became clear that the step to the advanced phase is really high. So meanwhile, while also the perspective has changed from do men care, we now ask the question, do companies, do organizations want men to care? So as mentioned, the early phase, the early stage companies were actually absent in the Men in Care study, but early phase companies on the leap to middle phase companies were evident. So what characterizes these companies was still gender typical social phenomena, as for example, the horizontal and vertical segregation. Top management were mostly performed independently of care tasks. So we heard in an interview that management was equated with extreme sport, for example, so no possibilities for caring masculinities. These companies are companies in which some possibilities for caring masculinities exist, but mostly based on informal agreement and mostly on the lower levels of the company. So how do the middle phase companies look like? These are caring companies, often characterized by a focus on the win-win perspective that you can see here in the quotation, where a police officer from Slovenia said, if you know that everything is fine at home, then you are more relaxed at work. When you know that the system allows compatibility, you are also free. You also feel more committed to the system. So this is also a kind of a win-win perspective that is mentioned here. So middle phase companies are often also characterized by a generational change and ambivalences. So it means we often see the picture of male-dominated cultures, traditional male-dominated cultures on higher levels. They are present, while at the same time the promotion of diversity and inclusion. So there are also measures implemented by younger employees, and we have traditional and progressive orientations at the same time that pull into different directions. So middle phase companies are also sometimes characterized by what we call verbal modernization and behavioral rigidity. They are often limited to single measures on caring masculinity, like, for example, a care bonus for men's job applications. And we see also in these middle phase companies that men are not isolated cases anymore. They are not devalued, but they are also not talked about. So usually it's not an issue in everyday work. The overall picture of the study shows that many of the male employees report good and so really supportive dialogues with their closest managers, bring about good arrangements, but the needs and dilemmas are usually not shared with colleagues. So they are individually kept by themselves. So now let's move to the last step, the middle phase companies on the leap to the advanced phase companies. They have a wide range of measures usually aimed at all genders, first of all, and also somehow structurally more embedded. So they also strengthen the care role of men as the measures address them directly. And this is also really important. So they really name men when talking about gender equality. Fairness and equity arguments are not required for men who take a care role. In these companies, a common reason seems to be good enough for taking parental leave, part-time, whatever. So flexible forms of work, reduced hours work, home office can be found in these companies on a structural level, formalized and also legalized. So men are mentioned when it comes to gender equality. Active fatherhood, reducing overtime work, self-care measures. These are measures and topics that can be found in these companies. In addition, we also see what we call a speak-up culture that provides a safe environment to discuss care arrangements and also male engagement. So compared, I come to the end, compared to the situation 20 years ago, the Men in Care study shows that men are now seen as potential carers for more companies. In most countries, this is a new norm. So fatherhood, I would like to see, has become visible. Laws have been introduced and some policies implemented. What is still missing seems to be threefold. The implementation of policies is still very sketchy, I would like to say, sketchy in most organizations. It's not really systematic and not consistently linked to gender equality and not consistently linked to human resource strategies on company level. And third, it seems to be entirely focused on fatherhood, while other aspects of care are still invisible. As I mentioned, our work was based on this wider concept of care, based on the concept of Nancy Fraser, who said care is a human norm. So we widen the perspective of care. But when looking at all these companies in these different countries in Europe, we saw that the main focus was on active fatherhood. So, and what we saw, it was the study was conducted from 2019 to 2022. And as you know, in March 2020, COVID has started. So under COVID crisis condition in the last 2 years, we saw how fast companies can change if they have to. So the need was evident under the COVID condition. So concerning caring masculinity, the need, but also the benefit has to be made clear so that the necessary next steps can be taken. Thank you very much.
Thank you, Ellie, who is perfectly on time. Congratulations. Amazing. Love speakers like that. I love all speakers, obviously. Apologies, Highness. Also love the ones who go a little bit over. All good. Thank you, Ellie, so much for the insight into the Men in Care project. I put the link to the results page in the chat, so everybody please check that out. It's amazing work that was done by so many project partners in, I was seven countries? Yeah, 6-7 countries. Amazing. Thank you so much. Dimi, it is now up to you to share insights into the currently ongoing Father's Rock project with us. So I'm very excited to hear from you, and I will start your clock now.
Thanks. Can you see my presentation? Great. Thank you. So thank you all the panelists and all the participants. It's really amazing to be here and have the opportunity of sharing and brainstorming together with all of you. I'm going now to introduce the Father's Rock project. The project was funded by the European Commission. It started at the beginning of this year and will end after 2 years of implementation. The countries involved are Spain, Italy, and Austria for the implementation, and then in Germany is WWP. We have Blanquerna coordinating. We have VMG for Austria, Connexus for Spain, and CAM for Italy, and WWP taking care of the dissemination. The long title of the project is Fathers' Engagement in the Role of Care, Keeping Mothers and Children Safe, with a special focus on enhancing capacities of perinatal services. In doing this, where perinatal services are intended as the services related to the pregnancy, to birth, and also puerperium and early childhood, including health facilities and education facilities for early childhood. We also have an amazing advisory board, keeping continuity with the past projects and the latest research with Marianne Hester, Professor Marianne Hester, and also Annina Labok and Andrea Santoro from the Giardino dei Padri, the Father's Garden in Italy. So the idea, as we were saying also in the previous presentation, is shifting the focus from women to men as well in when thinking about the responsibility of domestic affairs. This means that services in this case should start thinking about men as instead of beneficiary of care providers, instead of but also men of themselves should start thinking about themselves as care co-designer with mothers, instead of sometimes care competitors with children in some cases. Instead of babysitting, they could talk about parenting, because they are fathers. They are not, like we say in Italy, not we, someone, male moms. And for society, instead of money makers, they are also family members. So in our case, following the word joke of the title of the project, from being a rock, a granitic figure, from being rock. Our idea of being rock for men is sharing responsibility of care for children and for relationships to improve the well-being of all family, ecosystem, and self. So why Father's Rock? We know that pregnancy and childbirth can be moments of huge and deep change and crisis. And as all crises, this could bring to risk and as well as opportunities. The risk with this specific focus of domestic violence is the increase of violence from male partners during pregnancy and early and after birth, but also the opportunity, again, within addressing gender-based violence, is to see that fatherhood, the willingness to be a good father, is one of the most important motivators for men to undertake a behavioral change pathway. But we also know that services are not prepared for many reasons to address gender-based violence, to engage fathers, and so on. So this is the background of the project. How would we like to make our impact with this project? So mainly, we are going to improve the capacity of frontline professionals to involve and support fathers in parenting. But also, we are going to improve their capacity to identify risks and indicators of domestic violence and address gender-based violence with men, in the sense that they then could be able to see whether there are some indicators, and they will be able to talk to men and to motivate them to referral, and basically to start naming violence. All this will be supported by collaborating with key public institutions to give sustainability to the model that we are going to establish in the territories effectively. What we're going to do in the project is collaborating with the services and within this multi-stakeholders roundtable and co-design the capacity building for services to engage fathers and address domestic violence. We are then going to implement the capacity building training together with the services within the services, covering different areas. So as we were saying before, early childhood services, healthcare facilities and education ones, but also from pregnancy pathways and puerperium ones. And then we are going to implement the model, and this means implementing groups with fathers and also consolidating the establishment of the model among institutions and, of course, disseminating the model through awareness raising, targeting men and also institutions. All this will be done, as I said before, with an approach of a participatory approach to give continuity then to the actions after the project ends. Now we are here. We started the project at the beginning of the year. We are in the process of building the capacity building program. And what we have now ready is the need assessment. The findings so far strongly support our approach. We have targeted frontline professionals, perpetrator programs and women's support services, and also fathers and mothers within the needs assessment. And what we know from that is that there is a need to train frontline professionals, to enable them to name and address gender-based violence. There is a need to engage fathers and to offer fathers, to provide fathers with specialized services, with groups of discussion for them specifically. There is the need from the mothers to involve men and inform men about the implications on women's health and emotions during pregnancy and birth. And yeah, so this is what we have found so far. So we have a great opportunity to involve frontline professionals and to have frontline services bridging in all this process. What we are going to deliver at the end of the project, and we will be very happy to share at the end of 2023, beginning of 2024, is the fine-tuned capacity building program for frontline services to engage fathers and also to identify and refer gender-based violence. We are going to deliver the multi-agency collaboration model and education model for fathers' inclusion within the services. And also, which is really important, we are going to share awareness-raising materials targeting fathers, which will be focused on offering help and information with no stigmatization and, of course, no disempowerment for women. So empowering men with no disempowerment for women. If you want to know more, please get in touch. You will find all information available so far on our website, which will be updated progressively. And thank you so much.